Thyroid dysfunction is a sign of metabolic dysfunction, so we got to do proper testing. Now I'm going to go really quick through what we do here in our office for proper testing. We got to do a complete thyroid panel. If you've got a thyroid disorder, if you've got thyroid symptoms, you've got to do a complete thyroid panel. You got to look for those patterns of low thyroid function. You've got to rule out autoimmunity. Okay, we can't just look at TSH. That's not working. We got to look at vitamin D levels, okay? Especially if you have Hashimoto's, vitamin D levels are crucial with people with autoimmune diseases. So most thyroid patients I work with, their vitamin D levels are in the tank, okay? And maybe they've been prescribed vitamin D for a period of time, but sometimes we got to get a little more aggressive. Got to get more aggressive, got to get that out. We got to look at anemias, okay? If you're anemic, that's something that's got to be addressed before you even start working on some of that toxic load, because that anemia in itself could be your toxic load. It really can't. Got to look at kidney function. We got to look at blood sugar levels. Just like anemia, blood sugar levels have to be addressed, because if you think back to those patterns and how many of them had to do with insulin resistance or thyroid resistance, blood sugar levels have to be looked at. So if your blood sugar, if you're hypoglycemic or you're pre-diabetic, that's something that's got to be worked on, because that in itself may fix your thyroid function. We got to look for cerebellar antibodies, autoimmune. Other autoimmunities as well. We got to look at hormones. Okay, we got to look at an immune panel sometimes. We got to look at the relationship between your Th1 and your Th2 side of your immune system, because if you have an autoimmune disease like Hashimoto's, we got to find out what part of your immune system is not working properly, and then support that nutritionally to create a balance so your immune system doesn't go attack. And I could talk 30 minutes just on this in itself, but we're not going to do that tonight. Right? We got to look at the adrenal glands. All right. Most patients I work with, adrenal glands is a huge component with what's going on with them due to our society. We're go all the time, so our adrenal glands get really fatigued and get really worked on, and they're not functioning properly. So we do a saliva test. We call our circadian rhythm test, where we check cortisol 4 times a day to make sure that's working properly. Your cortisol should be the highest first thing in the morning, and then it should decrease slowly throughout the course of the day, so it's the lowest at nighttime, causing your melatonin to be its highest, where you get in those covers nice and cozy and fall asleep and stay asleep for 6 to 8 hours. Okay, so we got to look at how your body's pumping out cortisol through the day to make sure that graph in your body is spitting that cortisol out properly through the course of the day. Okay, so we look at 24-hour cortisol levels. We got to look at food sensitivity tests. Okay, we got to look at food sensitivity tests. We got to see if you're sensitive to gluten, soy, yeast, egg, milk. And then we got to look at other cross-reactive foods. If you're sensitive to gluten, we've got to look at foods that have very, very similar protein structure to gluten to find out what you're sensitive to. Because if you're sensitive to gluten, there's a good chance you could be sensitive to rice, oats, coffee, chocolate, you name it. So we got to do a food sensitivity test. Now, if you've had a food sensitivity test done in the past and you've been sensitive to everything you've been eating, well, most likely you got a leaky gut, so we got to fix the leaky gut issue and then retest food sensitivities to get a true depiction of what food you're sensitive to, okay? Because if you're eating foods you're sensitive to, that is just adding fuel on the fire, okay? If you are sensitive to gluten and you eat gluten, that's fuel on the fire. You're never going to get better, okay? So we've got to find out from a hit list, either through testing or elimination diets, what foods you are good with, what foods that you're not good with, and make sure you don't eat those foods that you're not good with, okay? Because if you eat gluten, you're going to feel lousy for a couple of days if you're sensitive to it. If you're sensitive to casein, which is the protein in milk, and you get some dairy, realize you're going to feel lousy for a couple of days, okay? But having that information is invaluable. It's imperative. You have to have that information on what food you're eating to be able to create lifestyle changes, dietary lifestyle changes going forward, that you don't add fuel on that fire every single day, okay? Let's say you have Hashimoto's and you're sensitive to a handful of things, and let's say you're sensitive to eggs, milk, and gluten itself, and every single morning for breakfast you have an egg, you have milk, and you have a piece of toast, and then you wonder why you feel lousy all day long, okay? You just put fuel on the fire to start your day off. Okay, got to test for it. You got to test for it. Now realize in food sensitivities, there are bad and they're good. I use a lab called Cyrex Labs, C-Y-R-E-X labs.com. You can go to their website. They got a great thing, a video on autoimmunity. They are probably the best food sensitivity testing company I've used. There's some other ones we use as well, but they're the best. And like I said, that in itself, it changes people's lives pretty quickly. Okay, and then we work on all those toxic loads, chip away at them once we get information back, and it changes people's lives real quick. We got to look at a stool microbial. So if you've possibly got GI issues or possibly from blood work, there's things telling us that maybe there's some gut issues. We need to look and rule out infection, parasites, yeast, bacteria. We got to look for a dysbiosis presentation, meaning the relationship between good gut bacteria and bad bacteria. And if you have too much bad gut bacteria, not enough good, we got to make sure that we supplement properly to bring that back up. So these are the things we got to look at. Okay, and these things are not looked at. All right, and you know, these are the things that help us determine what your toxic load is. And once we have that information and we know what is causing your body to break down, we know how to support it. Okay, and due to that, your life changes, and it changes pretty quickly. And you have that information going forward that is going to keep your life in check for the rest of your life.